Stopping your statin after 65 can change your body faster than you think, and the most dangerous part is you may feel fine while the risk is quietly rising. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share science-backed health tips like this every single day. Over the years, one pattern keeps showing up. Someone feels a little better after stopping a statin, so they assume the danger is gone too. But your body does not work like a light switch. The pill stops, yes, the hidden protection can stop with it, and because that change is often silent, many people do not realize what is happening until much later. Here's the thing, most doctors are not hiding this from you. Office visits are short, problems compete for attention, and the quiet things, the invisible things, often get rushed past. So today I'm going to walk you through what can happen inside your body when you stop taking statins after 65, what is normal, what is not, and what you should do before you make any move. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think the question is simple. Either statins are good or statins are bad. Either you stay on them forever or you throw them in the trash. But that is not how real medicine works. Not black and white, but risk and benefit. Not internet fear, but careful timing. Let me be clear, statins can cause side effects in some people. That part is true. But a lot of people stop them for reasons that have nothing to do with the statin at all. A 2022 study led by Oxford Population Health found that 14 out of 15 reports of muscle pain or weakness were not actually caused by the statin. Think about that for a second. If you stop the medicine for the wrong reason, you may lose a benefit you still needed, and the stakes are not small. A 2019 study from Sorbonne Université found that adults around age 75 who stopped statins had a 33% higher risk of being admitted to the hospital for a heart or blood vessel problem. So no, this is not just about a cholesterol number on a lab sheet. This is about what is happening inside your arteries while you are busy living your normal life. So let's count down the 5 biggest things that can happen in your body when you stop taking statins after 65, and why number 1 surprises almost everyone. Number 5, the cholesterol snapback. Most people think if they stop a statin, their cholesterol rises slowly over many months, but actually, for many people, it can rise much faster. Your liver is like a factory. A statin turns down the speed of that factory. When you stop the statin, the factory can ramp back up. A 2024 study from the University of Castilla-La Mancha found that after statin withdrawal, LDL cholesterol rose by 30% in just 4 days. Not 4 months, 4 days. It peaked even higher over the next 1 to 2 weeks. That means your bad cholesterol can rebound before you even finish telling yourself you're just taking a short break. Why does that matter after 65? Because by this age, you have had decades for cholesterol to settle into artery walls. High LDL is not like dust on a table. It is more like grease building up inside old plumbing. Add more grease and the flow gets worse. So what do you do if you are thinking about stopping? First, do not stop cold without a replacement plan from your clinician. If the plan is to lower the dose, switch the drug, or try a different schedule, that is very different from simply quitting. Second, if any statin change happens, ask to recheck your lipid panel in about 4 to 12 weeks. You want proof, not guesses. Third, start feeding your body foods that physically help drag cholesterol out. Aim for about 10 grams of soluble fiber a day. That is the type of fiber that turns gel-like in your gut. It acts like a sponge. An easy example, about 1.5 cups of cooked oatmeal can give you a solid start. Add half a cup of beans, 1 apple or pear, and a teaspoon or 2 of psyllium husk in water if your doctor says it is okay. That is not magic, but it helps. And if you use foods with plant sterols, aim for around 2 grams a day. Some fortified yogurts or spreads are made for that. Just read the label. Why guess when you can measure? Quick question. Have you ever had muscle aches or weakness after starting or stopping a statin? Comment yes or no below. Because what happens next is something most people never connect to the pill at all. And it brings us to number 4. Number 4, your artery lining loses some of its calm. Most people think statins only change cholesterol, but actually they also help the lining of your blood vessels work better. That lining is called the endothelium. In plain English, it is the slick inner skin of your arteries. It helps blood move smoothly. It helps arteries relax. It helps reduce irritation. A 2023 study from Stanford Medicine found that statins help protect the cells lining blood vessels and improve vascular function, meaning the arteries can relax and contract more normally. Picture a non-stick frying pan. When the surface is smooth, things slide. When the coating gets damaged, everything sticks and burns faster. Your artery lining is similar. Not a frying pan, but a protective surface. When that surface gets irritated, blood vessels can become stiffer. Blood pressure can become harder to control. Inflammation, which is your body's internal irritation signal, can become a bigger issue. You may not feel that happening. There is no alarm bell, but your circulation feels it. So how do you support that artery lining if your statin plan changes? Start with movement. A simple 20 to 30 minute walk most days is powerful, not a marathon, but a daily rhythm. After that, use food like medicine. 2 tablespoons of extra virgin olive oil a day is a smart target. A small handful of walnuts, about 1 ounce, adds healthy fats. 2 cups of leafy greens a day can help blood vessel health too. Spinach, romaine, arugula. Simple choices, and watch the hidden attackers. Smoking, high blood sugar, poor sleep, and high stress all irritate that vessel lining. So if you stop a statin and keep all those problems the same, you are not removing one risk. You may be stacking several, but wait until you see number 3, because this is where the danger becomes more physical, more real, and much harder to reverse. Number 3, plaque can become easier to disturb. Most people think artery plaque is like a hard lump of chalk, but actually, some plaque is more like a sore spot under a thin cap. If that cap cracks, your body can react by forming a clot. And that clot is what can block blood flow to your heart or brain. Statins do more than lower LDL. They also help make plaque more stable. That means less likely to crack open. So when people stop them, especially after taking them for years, they are not just changing a number. They may be taking away some of the glue that was helping keep a weak area quiet. A 2021 study connected to the University of Southern Denmark found that adults aged 75 and older who stopped long-term statins had a 32% higher rate of major heart and blood vessel events in those using statins for prevention, and a 28% higher rate in those who already had cardiovascular disease. That is not a tiny shift. That is a meaningful jump. Think about an old road with cracks in it. As long as the surface is sealed, cars pass over it, stop maintaining it, and water gets in, then cold pressure and time do the rest. Your arteries work the same way, not in a dramatic movie scene, but through quiet wear and tear. So what helps keep plaque more stable? First, consistency. Do not skip doses on weekends and double up later unless your doctor tells you to. Your body likes steady signals. Second, keep blood pressure controlled. High pressure pounds against weak plaque like a hammer. Third, eat more omega-3 fats from real food. 2 servings of fatty fish a week is a good goal. A serving is about 4 ounces cooked. Salmon, sardines, trout, or mackerel all work. Add 1 tablespoon of ground flaxseed to yogurt or oatmeal if you tolerate it, and cut down the foods that act like lighter fluid on inflammation. Deep fried foods, processed meats, and constant sugary snacks do not help you here. You do not have to eat perfect. But you do need a direction. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Now, number 2 is the one that scares me the most because it fools people who feel completely normal. Number 2, your heart attack and stroke risk can rise quietly. Most people think if something dangerous is happening, they will feel it, but actually, clogged arteries often grow in silence. No pain, no dizziness, no warning. Then one day something blocks enough blood flow and life changes in minutes. A 2019 study from Sorbonne Université found that stopping statins in older adults was linked to a 33% higher risk of hospital admission for a cardiovascular event. Not because the body suddenly falls apart overnight, but because the background protection gets weaker while the artery disease keeps doing its job. This is why stopping after 65 is different from stopping at 35. At 35, some people have less built-up damage. At 65 and beyond, the road has more miles on it. The pipes have more wear. The heart has more history. That does not mean you are fragile. It means you need strategy. So what should you do right now to lower that silent risk? Learn the signs you cannot ignore. Pressure in the chest, pain moving to the jaw, back, or arm, new shortness of breath, sudden weakness on one side, trouble speaking, sudden vision loss. Those are not sleep it off symptoms. Those are get help now symptoms. Then build your daily protection. Aim for 25 to 30 grams of total fiber each day. A cup of lentils gives you a big chunk of that. Half a cup of chickpeas helps. 1 cup of berries helps. Half an avocado helps. Keep a home blood pressure log 3 times a week. If your statin changes, ask for cholesterol labs, blood sugar, and liver tests if your clinician thinks they are needed. Why drive with no dashboard? And do not underestimate walking. 30 minutes a day, broken into 3 10-minute walks if needed, is still real exercise. After meals is even better for many people. I'd love to hear your story. What made you click on this video today? Share in the comments. Because number 1 is where a lot of good people make a bad decision, and they do it thinking they are protecting themselves. Number 1, you may stop for the wrong reason. Most people think my legs hurt, I feel tired, I forgot a word, so it must be the statin. But actually, after 65, there are many possible causes for the very same symptoms. Dehydration, low thyroid, low vitamin D, arthritis, poor sleep, another medication, even normal aging. A 2022 study led by Oxford Population Health found that more than 90% of muscle symptoms blamed on statins were not caused by the statin. That does not mean your symptoms are fake, not at all. It means your symptoms deserve a real check before you throw away a medication that may still be helping you. Here's the thing. Stopping the statin may make you feel better for one reason while putting you at risk for another. That is the trap. Relief is not always proof. Feeling different is not always the same as being safer. So if you think your statin is causing problems, do this the smart way. Ask your clinician to review every medicine and supplement you take. Some drugs can raise statin side effects. Ask whether you need tests for muscle injury, liver strain, thyroid problems, vitamin D, or kidney issues. Ask whether a lower dose, a different statin, or an every other day schedule could help. Some people tolerate one statin poorly and another one just fine. If you truly cannot tolerate statins, you still need a backup plan, not wishful thinking, a plan. That may include another cholesterol medicine, plus food habits that lower risk from several directions. A cheap day could look like this: oatmeal at breakfast, half a cup of black beans at lunch, frozen vegetables at dinner, 1 tablespoon of ground flaxseed, and a 20-minute walk after your biggest meal. Simple, repeated, affordable. But before you rush off and change anything, let's pump the brakes for a second. I'm not saying this to scare you, but stopping a statin is not something to do casually after 65, and I am definitely not saying everyone should stay on one forever no matter what. Some people do need to stop or change treatment. Severe muscle injury, which can show up with intense pain and dark urine, is different. Serious liver problems are different. Major drug interactions are different. Frailty, advanced illness, or end-of-life care can change the goal completely. This is why your full picture matters. Not just your age, but your heart history, your stroke history, your diabetes, your blood pressure, your kidney function, your other medicines, and how you actually feel. Grapefruit can interact with some statins, so can certain antibiotics, antifungal medicines, transplant drugs, and some heart rhythm drugs. If your medication list changed, your statin conversation may need to change too. And if you already stopped your statin and now have chest pain, shortness of breath, slurred speech, sudden arm or leg weakness, or sudden confusion, do not wait for a comment online. Get medical help right away. Those are emergency signs, so you're convinced but thinking, how do I actually do this? Start simple. Do not stop your statin today just because of this video. If you have concerns, make an appointment and say one clear sentence, I want to review whether this statin is still right for me, and if not, what the replacement plan is. That one sentence can save a lot of confusion. Next, bring your full medicine list. Every pill, every supplement, every powder, every gummy. Then ask 3 practical questions. What is my actual heart and stroke risk? What side effect are we trying to solve? What is the plan to monitor me if we change this medicine? After that, build the cheapest heart-friendly routine you can live with. Store brand oats, canned beans, frozen vegetables, canned salmon or sardines if you like them, olive oil used lightly, a daily walk in your hallway, driveway, or local store if the weather is bad. You do not need exotic powders. You do not need a fancy supplement stack. You need consistency. And if cost is the problem, say that out loud. Generic statins are often inexpensive. Different dosing plans can sometimes help. Other medicines may be options if your doctor thinks they fit. There's almost always a smarter path than just stopping and hoping. Look, there's a lot of noise out there. One person says statins are poison. Another says everyone should take them forever. The truth is quieter than that. After 65, stopping a statin can raise your cholesterol fast, reduce protection in your blood vessels, make plaque less stable, and increase your risk of heart attack or stroke, especially if you stop for the wrong reason and without a plan. You don't need to overthink this. Start with just one step. Review your statin plan with your clinician before making any change. That's it. One smart step. Your body will tell you if it's working, not always with feelings, but with numbers, blood pressure, energy, and time. You are not powerless here. You are allowed to ask questions. You are allowed to want side effects taken seriously. And you are also allowed to protect your heart while you do. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.